Welcome to the 2.0 conferences. It's a pleasure to have you here and congratulations on all of your accomplishments. Can you start off by introducing yourself and your organization?
Sure. So I'm the President and Chief Executive Officer for Community Health Associates.
Beautiful, thank you. So how did it feel to receive this award? I know you're an honoree here. Can you go ahead and elaborate on that?
Sure. So it's greatly a good honor to be participating and also receive the award. My whole firm is really built on interprofessional collaboration in healthcare. And so it's always nice, especially with my background being in infectious diseases, to have that recognized, especially post a pretty large global pandemic as we've all endured together.
Yeah. So. Nice. Okay. Well, congratulations once more. And I do have a follow-up question with your accomplishments. What would you go ahead and give advice on for anyone wanting to follow in your footsteps?
I think first and foremost is to get yourself out there, to go outside of your comfort zone, to really, I think, take an opportunity to go to different places that you wouldn't be exposed, just like this conference where you've got multiple different disciplines here together. I think number two is to always advance your own education. You can't ever stop learning. Complacency kills. And we see that in healthcare. And so the more that you know, the more knowledge you have and the more you have to bring to the table. And I think lastly is build a network. Just like at this particular conference, you have different disciplines here. You have different types of people with different experiences from all over the world. And I think that that's really critical to building success as both a business as well as an executive.
Perfect. So basically knowledge is key and also your team.
Absolutely.
Yeah. Beautiful. Now, how has your learning and networking experience been so far at Health 2.0 conference?
So this is my first time here. I've certainly been to Las Vegas many times for other medical conferences. This is probably my first where there's different disciplines outside of even healthcare. If you think about marketing and internet, which are directly across from us, those are really core areas that we need to leverage, especially with the AI coming into healthcare. And so it's an interesting perspective to have those different individuals here, the skill sets, and to hear a little bit more about what's going on in other segments of the market, particularly in education, which directly impacts me. I do a lot in education as a professor also, so it's been quite an intriguing opportunity.
That's great. Basically, doorways have opened for you guys to communicate and, get in contact with people that you probably wouldn't have.
Sure, for sure.
That's great to hear. That's great. Now, where can other people continue to contact you to receive collaboration advice?
So I definitely have a lot of people that follow me on LinkedIn, but my website is hudsongarrett.com, and certainly welcome you to check that out. We're kind of a boutique firm, so we work with a variety of different stakeholders. Years ago, we started off doing training and sort of competency management, and then we evolved into working with medical device companies and pharmaceutical organizations. And most recently, we started working with nonprofit associations. So we really have a complete portfolio of services and training opportunities, as well as do a tremendous amount of speaking engagements.
Perfect. Well, you guys offer a lot of services, so that's great to hear. Now, my last question is, how has the work for your company changed since COVID?
In every way. I think if you have not changed since the pandemic, you're probably missing out on an opportunity. We have completely transformed the way that we do business. We really never had to make the shift to virtual because we already had that capability and talent and expertise in-house. But we've really tried to say, how do we make sure we bring a different level of value to healthcare? Patients expect it. We're both patients. We receive healthcare services. I know that the bills keep going up, and so our expectation for value as a patient goes up as well. And so we have to change the services so that they match that. And I think that's the uniqueness about my organization, is that we don't function in one area. We really reach across different disciplines in medicine and healthcare to make sure that whatever the complex challenges that we're facing, we can solve it together.
I love that answer. All right. Well, thank you so much for being here. And again, it was a pleasure. And I hope to see you come back. And again, congratulations.
Thank you so much.
You're welcome.